Good afternoon, and welcome to day 2 of National Black Child Development Week 2020. I'm Tobeka Green, and I have the honor and privilege of serving as the National Black Child Development Institute's president and CEO. We are so thrilled that you would join us again today, or perhaps join us for the first time today. National Black Child Development Week is an annual event. Annually, we turn the nation's attention to the strengths of Black children, their brilliance, their creativity, their beauty, and to the inequities that inform their ecosystem. The National Black Child Development Institute is celebrating 50 years of unapologetically pursuing our mission to improve and advance the quality of life for Black children and families through education and advocacy. We develop and deliver strengths-based, evidence-based, culturally relevant, and trauma-informed programs, training, and technical assistance that focus on family engagement and health and wellness. With our national affiliate network, we advocate and inform equitable policies that ensure that all of our children are successful in school and in life. As we're in the midst of dealing with COVID-19, as we're all learning how to adjust to our current realities, the board of directors and staff join me in sending warm wishes to all of you, wishing for safety, wishing for good health. I am joined today by Carlos Rodriguez, who is the president and CEO of the Community Food Bank of New Jersey. Carlos has spent a couple of decades focused on being a passionate advocate for hunger and also for the working poor. Carlos, welcome.
Pleasure. Thank you for having me.
This is our second day of conversations regarding food insecurity during COVID-19. Because the National Black Child Development Institute focuses on the strengths of our community, of our children, we started yesterday's conversation focused on what's working as we looked at how Black churches are responding to food insecurity. And so yesterday, we highlighted the work of Trinity United Church of Christ, located in Chicago, Illinois, and Community of Hope African Methodist Episcopal Church, located here in the DC metro area. We're excited, I am, to have this conversation with you because we'd like to delve a bit deeper and just fully unpack food insecurity. And I think one of the best ways to do that is to start by understanding what is food security. And then let's understand what it means to be food insecure. I was overwhelmed by our pre-COVID numbers as it related to food insecurity and learning that 37 million Americans are food insecure and 11 million of them are children. And so please help us understand what it means to be food secure, and then your definition of food insecurity.
Well, I'm so glad you're framing it in the positive, because that's the goal. How do we create a food secure society for everyone? And when you're food secure, that means you have reliable access to affordable, nutritious food, enough for any family and any individual to be able to live a healthy and active lifestyle. That is food security. That is what we all strive for. That is what many of us probably take for granted in being able to access. That, unfortunately, as you mentioned, is not the reality for more than 37 million across the country.
So as we think of food insecurity pre-COVID, give us a sense of the landscape in New Jersey.
So in New Jersey, we had just around 10% of the population that was food insecure. That means they didn't have that reliability to nutritious food, affordable nutritious food at any given moment in the future or within the last year. And that equates to, and this is, by the way, the second wealthiest state in the country. That equates to over 900,000 New Jerseyans that were, in fact, food insecure. This is as recent as February, when the economy, by many definitions, were booming and reaching so many. In fact, across every community in the state, as you will find across every community across the country, there were families being left out without access to this very basic necessity, food.
And Carlos, these are working families?
These are large in part working families. So let me put that in perspective for you.
Okay.
When our organization started, was born out of a faith base, really pantries and soup kitchens coming together. That's how food banking, and I love the fact that you had our faith-based partners highlighted yesterday because they are the cornerstone to how we address food insecurity. So when we first started doing this 45 years ago with our network of pantries, soup kitchens, and other feeding programs, maybe 1% of the population, no more than 3% for sure, we estimated were working families. Today, nearly half of the families have at least one person employed that still rely on food pantries, soup kitchens, and other feeding programs to make ends meet.
I will share with you, Carlos, in the mid to early 2000s, I was a volunteer at a food bank that was faith-based and supported by the Capital Area Food Bank. And one of the sobering things for me was seeing the same families routinely coming in and wondering and hoping that there might be more comprehensive supports. And so when we think about just this space of food insecurity being a constant, what are some of the strategies that you would recommend for organizations like the National Black Child Development Institute, faith-based organizations, other entities that want to be a part of the solution addressing this? And we'll talk a bit more about policy and the implications there in a few moments.
I think the first thing we have to do is understand the problem. So we talk about food insecurity versus hunger. Hunger is when you have that yearning and that emptiness of food. Versus what we strive for in one of the wealthiest societies in our world, which is to make sure that you have that access to that food that, quite frankly, is all around us. And so I think the first thing we have to do is understand the problem for what it is and for where it is, and then understand the why it exists. And I think that's where it gets really interesting and we can really lean in. So food insecurity is not born because there's no access to food. In fact, you have many families that are living right across the road from a very well-stocked market, or just very few. There are food deserts in our society and in our country, and they seem to align with low-income families and people of color in particular. But that's, I think, in large part, when you're talking about close to 40 million people, it's just the financial access to food that's missing. And food becomes something that is easy to trade off. If you have to pay the rent or pay something that has a more immediate consequence, you start by literally rationing out what you have to eat. The first thing that falls off the proverbial table is the nutritious quality of the food. The second thing is maybe mom, dad goes without a meal so the children can have. And then have to struggle to go to work the next day on an empty stomach or without the fuel that they need to be successful. And so I think we have to understand the problem for what it is. And it is it's lack of financial access to a resource that we have in this country in abundance. We also have to understand the issue of equity or inequity and disproportionate impact that the problem has. So we spoke about 37 million families across America who are in fact food insecure. It's important to point out that among African American families, they are twice as likely to face hunger as compared to white non-Hispanics. And so when you start understanding and putting the history of the group, of any group, and the context of how they live and why they live in a certain way in our society, you can understand the disproportionate impact of food insecurity, which doesn't live by itself. It lives as part of an ecosystem of need. It lives in the construct of financial security, of how one becomes wealthy, who gets impacted and falls back when there's a crisis like COVID or anything else. That was a mouthful. Let me
No, no,
stop there, and we can tease it out some more.
no. When you talk about the ecosystem, of course, I immediately think about schools and the role that schools have played in ensuring that most of our children, at the very least, have access to 2 meals a day. And so, as we've seen schools shuttered, knowing that some are actually still providing meals during the day, give me a sense of your immediate reaction and what level of mobilization was then required as we began to understand that schools across the country would be closing for weeks or for some unknown period of time.
Once we saw this pandemic coming, and it was like watching a slow moving train come at you, and not being able to figure out which way to get off the tracks here, right? Literally, one of the first things that we started doing when it was clear that there was going to be a mass shutdown of some sort is start engaging policymakers in schools to make sure that those school meals do not go away. Because if you think about how important it is for so many children to have those 1, 2, and sometimes even 3 meals, depending if you're in an after school program, it has a budgetary impact on the family. Like if you don't budget for those 3 meals, now all of a sudden you have to figure out how to make up and align resources for those 3 meals. So we really in the very early days were making sure that schools continue with the free and reduced school meals, and that policies at the state and federal level were in support and would accommodate with the right waivers those meals continuing. And it was, like everything else, it was trying to figure this out as it came at you and as it unraveled. But I think one of the early successes was calling for that vital program not to stop dead on its track. And we continue that because we know June 30th is going to stop dead on its tracks. And we have to figure out how to launch a summer meal program that's more robust than it's ever been able to be. And that's important because what we want to do is make sure that families have access to at least the resources that have always been available.
Right, right. You're taking me back. I won't date myself by saying how long ago, but during my high school summers, I would often work with our summer recreation program that provided breakfast, lunch, and a snack for children, really kindergarten, really actually age 4 through 12th grade. And it was just a wonderful opportunity to ensure that they were being fed. All of this, though many are supported by federal dollars, there's also the need for additional dollars from donors. Talk to me about what you're seeing at the food bank. Has there been a significant increase in contributions to support our families and our communities during COVID-19?
There has been, and thank goodness for that. It's the financial support that has really fueled our ability to provide food and other resources to families during this time. But it always is the case, but especially during this crisis. And I'll share with you why. One of the things, and we can probably all relate to some level, seeing the empty supermarket shelves at some point over the last few months. And so what happens and what that translates into is that the excess food and many donations that came from those very markets disappeared almost overnight. So in New Jersey, for example, in our food bank that serves 16 out of the 21 counties, that means that we lost over 1 million pounds of food every month since the pandemic started. So that's 1 million pounds of food where we were mostly disproportionately on a monthly basis relying on donations like that to be able to meet the need. And so what happened is that went away, and there was a surge in need simultaneously. We estimate 50%, if not upwards of 50%, is what the need increased in New Jersey since the pandemic. And so we've had to reinvent and re-engineer our response, not just to deal with the shortfall of food, but also the increase in need for that food. And in large part, the punchline is in large part what we've had to do is purchase much more product, not only to replace the 1 million or so in food on a monthly basis, but to also help us overcome the increase in need and the surge in need that we've seen from our communities.
So help us understand, as we've worked with multiple partners, there are different price points. In one space, a $100 donation provides 30 pounds of food for 300 families. In another space, through a great partnership, it's $22 per 30 pounds of food. Help us understand that differential and what informs it.
So I think that the balance between the donated product that comes in, the purchased product that comes in, government commodities that we're able to leverage to make that quote unquote bundle or that basket of nutrition that's needed in our community helps inform the price point. Also, the complexities on, it's not just bringing the food in, but it's making sure that the food finds its way to every community and meets the community where they are. And our faith-based partners, our local pantries, soup kitchens, with the capacity that they need. And so there's a distribution of logistical costs to handling and transacting that. So for us, every dollar helps support at least 3 meals. And that price point is increasing. For us, we're making sure that more than 92, 94 cents of every dollar goes right into programs and services, including food. And that's important because whether it's food or that dollar, it's a precious commodity for us. It literally means the reliability of someone to be able to feed themselves and their family, the ability for them to have that cornerstone meal that allows them to be healthy, not hungry. And so that's how it translates for us.
Okay, thank you. My next question is really in 2 parts. Give us a sense of the reality for your staff during this time of increased need, the impact as they have families as well. And then I want to talk a bit about what we can do. So again, the nonprofit sector, the corporate sector, other sectors and individuals can do to lend support during this time.
Well, first, the team at the Community Food Bank of New Jersey is nothing less than amazing. I hate using the word resilient because we shouldn't have to be this resilience. We should have
Amen.
the resources that we need to be able to weather these storms. But the resiliency, the adaptability that they have demonstrated in the face of what they're dealing with personally has been nothing short of amazing. We've had to change our operations, do what we've done in close contact in some cases with our partners, figure out how to work it remotely. The frontline team members that are literally receiving the foods and working the food to get it into the communities went from working on average, on a 10-hour shift, where you would start, at different times, to working a 24-hour cycle with 3 8-hour shifts. So we literally have 6 days a week team members working overnight. And we did that because we had a social distance. So if you ever have a chance to visit our facility, it's 285,000 square feet. You'll get your steps in. You'll get your steps in if you walk in when you do a tour. But it's literally about the size of 5 football fields wide. And we had to spread them out even further in order to move the amount of food that we knew we needed to and do it in a safe manner. So they had to adapt to that while being school teachers at home in some cases, or managing coming to work and being school teachers at home. And many of our team members have had to have lost family members and loved ones and have not had the chance to mourn. And it's been a struggle, but it's a testament to their commitment to mission and their commitment to community that they continue to do things in the safest way that we understand and are able to do, but to be able to adapt and I think deal with and manage their personal the personal crisis that we're all dealing with and managing at some level, but really be very selfless and put that at the back burner so that they can continue to respond to those that are even more needy and more despair.
So first, our condolences to you and the team as they are dealing with losses. Part 2 of my question is informed by good news from yesterday's conversation. I asked the question regarding volunteers, the role of volunteers now, and both pastors were able to report that they had an abundance, an overflow, more than they could actually engage each day that they were distributing food. Is there a role currently for volunteers at your food bank? And I'd ask you to project beyond yours in answering the question.
There is, but there's a caveat to that. So for distribution events, especially the large ones and the local ones that are that you heard described, I'm sure yesterday, there is an abundance of willingness, and people just, the community always steps up to help our neighbors in need. The challenge for us is in traditional volunteer opportunities in our facility, where we've had to, again, because of social distancing, had to spread them out in a different way. So normally we could have a couple hundred volunteers throughout our facility sorting food and packing boxes. We've limited our volunteers to about 60 so that we can bring in who we bring in a safe, healthy manner. And so that's a challenge. That's been a challenge, but it's one that we've been able to overcome by just, inviting in the right type of volunteers. And of course, for our distributions in different communities, we do invite folks to come in and help us hand out food, and we have the right protocols in place. So, we're not only managing a need for more food, we're also managing a pandemic and the health realities that are still in so many ways unknown and evolving. And that's the challenge.
Thank you for that. I will say to our participants, please submit your questions via Q&A. And so if you look for the Q&A icon, not the chat icon, but the Q&A, we will be taking your questions. And I actually have a question for you now, Carlos. It's a direct question. I asked it more generally. The question is, how can a person volunteer or donate to your project, to the Community Food Bank of New Jersey?
Well, first of all, thank you for the willingness to support. And the best way, and because opportunities are constantly presenting themselves and the need is continuing to evolve, is visit our website at cfbnj.org. Again, that's cfbnj.org. And you can find opportunities to share your treasure, share your time, and share your voice to help us, help a neighbor access food, because there are resources there as well. But of course, be able to tell the story and invite others to be part of the solution with us.
So we have another question, and I'll contextualize it a bit. Often, due to a desire for privacy, perhaps a bit of pride, or perhaps shyness, there are families who are parents who may be hesitant to actually engage and come in to a food bank. The question is, how can we encourage a parent that is in need to receive these resources? Can you talk a bit about the intake process and how your staff engages, understanding now much of that may be remote?
Exactly. Most of the engagement is very minimal to receive food. And as a matter of fact, it's designed that way. And most food banks follow a similar process. Most Feeding America food banks, I would say, in our respective networks follow the same process. And it's very minimal. We don't even take signatures. We'll take a name in most cases and some additional background information as required, very minimally. But it's, hey, are you impacted by the disaster? Yes. How big is your family size? Great. What's your family name? Okay, great. And here you go. Yes. We do during normal times engage in more so that we can provide more and connect you with resources that help solve the problem. And I think the first thing to say is, let me step back and say, there is no shame in nourishing your family.
Amen.
Period. End of story. There is no shame. It is not your embarrassment that you fell on hard times. It is our society's embarrassment that such a thing can even happen. And I think we just need to lean in with that and invite hopefully this can create empathy when we see so many folks that are this vulnerable, in fact, that we'll have much more empathy and we'll be more inviting, because the idea here is not to stop hunger. The idea is to become food secure, to nourish your family so that we can be as productive a member of society as I know many of us actually want to be. Don't let this be a barrier, and don't let shame, this concept of shame, be a barrier.
Well said. I agree. I have a question. They're asking us to revisit, given that it is likely that COVID-19 will continue in a significant way, and that we need to look beyond that June 30th date for school systems that are ending that late. The question was, are you in discussion with school administrators to continue serving meals? And I know we talked about the policy approach to this, and it seems that there's been discussion, but has there been a coordinated discussion with your local schools?
So there has been, and I think there will continue to be. I'm fortunate to have been invited to the Restart and Recovery Council and Committee that the governor has put together. So this is something front of mind for not only for us in New Jersey, but I think around the country, on how do we continue meals in the school setting and beyond, right? Because we're still dealing with the immediacy of this problem, the immediate need that this pandemic has caused. We are thinking about the near-term transition and recovery, and it will be staggered, which means there'll be staggered needs and evolving needs that will be redefined, unlike the stop, which was pretty hard and fast, or the pause, as we say, that the economy took and so many jobs took. And that will come with challenges. How do you feed your child if you have to go back to work? What's going on with childcare and after school programs and camps that so many families rely on. Right now, those things are open for essential workers, and there's a combination of that and family care going on in our communities. But how does that transition as things roll out in an unnormal way? And I think more important, the work in front of us is the recovery. We know after every disaster, we sprint into action, but when you look back, the marathon effort is the recovery effort that will, and for this one in particular, it will leave the aftermath of, paychecks going missing for 3 months and bills piling up, and how families will have to dig themselves out of that reality. Best case scenario is that they start by going back to a job and to a work that's in the same way that they left off in February. We know that's not going to be the case for everyone.
Yeah, there's so much to unpack there, but I'm going to stay for a moment with schools as we are future focused. Again, sharing a bit of my background, I am a passionate advocate for wraparound supports. I had the opportunity to work in a dropout prevention that had wraparound supports as its core. And so and working here in the District of Columbia, or with the public schools in the District of Columbia. And so pre-COVID and 5 years ago, we were implementing the backpack program or the brown bag, the weekend program, where we would send food home for the entire family to ensure that everyone had a level of sustenance over the weekend. How do you think, are the conversations happening to again return to those comprehensive supports post-COVID as we project what the landscape may look like, given that we have no idea what it will truly look like or when we will really be back to go?
It's absolutely a commitment that I know I personally share, my organization shares, and that many advocates around the state of New Jersey and even nationally, our Feeding America partners and sister food banks do. Hunger is not an isolated issue. It's not a problem that lives in and of itself. It is a problem that lives in a broader ecosystem of need, if you would. And we need to start talking about how we bring in these wraparound services to deal with the underlying issue. And from the perspective of this food bank, we can use food to fuel services. Food is an important gatherer. It's a cornerstone to be able to do many things, whether it's providing a meal in an after-school setting, in a school setting. It starts the conversation around why this meal is so important. And more importantly, it takes the basic need away and allows to focus and for clarity to help solve other problems, more complex problems, perhaps having to do with financial and other social issues that might be going on in the family.
This next question it states, you mentioned that stores aren't donating as they used to because of demand in stores. Are they donating money as stores are seeing greater profit than ever before? And so understanding that they no longer can donate food, are you finding that they are donating money to the food banks in their local areas?
Our food industry partners continue to be exactly that, partners and tremendous supporters. And they were quick and fast to, even before they even counted, I'm sure, profits in many cases, to pledge their support for local food banks. And it's not just a run on goods that happened early on and continues to disrupt the supply chain. It's really supply chain issues going all the way to the manufacturer and the farms. And we've all seen the stories of, one supply chain to restaurants and big food, stopping dead in its tracks, and then food being, literally plowed over and thrown away. In some cases, while in our markets and in our pantries, it's hard to get enough food in and manage that supply. So there are bigger policy issue and fractures that have been exposed that I think will be the topic of bigger policy conversations in months to come. But I think the short of it is our food industry partners continue to be exactly that, partners and tremendous supporters throughout this pandemic, as they are year round.
That's great news. As we're continuing to delve into this, I do want to spend a bit of time focused on policy. When just sharing our mission with the audience, I did say that we're improving and advancing the quality of life through education and advocacy. And so if we are local citizens, if we are a small group of concerned citizens, a small local nonprofit, we want to get involved in advocating to end food insecurity. Give us a sense of either our top 3 talking points or and data points that we would incorporate as we begin these conversations with our elected officials.
I think the first thing is how we started the conversation is food insecurity lives in every community in our country. And it does not discriminate. It has disproportionate impact across more vulnerable populations, but it could be found in every single community and across all demographics, from working poor families, which we discussed, to college students on campuses, and everywhere in between. Hard times will find you, and the first thing that falls off that basket of need, if you would, is food. And I think that's the first thing. The second thing is, let's tell the story in that qualitative way, but let's also quantify it. We're in the middle of a census. We have to be counted. And we have to count where these programs, where family in need really lives. So I know one of the things that we've done is in every emergency box that we've put together, we've put census information there, and we put information on other resources like SNAP and school meals and whatever comes up and it evolves, so that information is available and accessible. Because the misinformation in our communities, that in a designed way to promote stigma, perhaps, it runs rampant, and we have to let the facts kind of lead the way and help spread and help inform the discussion of who is in need and why and what we can do about it. So let's dispel the myths on who's hungry and why. It's financial access. It's many working families in large part. Yes, there are generational pockets of poverty for sure, and those are harder to untangle and manage. But the perception is something that really needs to be addressed, especially with policymakers.
And I limited you to 3, understanding that it's a complex issue. There are more. If there are other recommendations that you'd share, please do. It's not often that we hear elected officials who are passionate advocates in this space. There are some, but it's typically not the leading topic of the day. How do we work to ensure that this is a priority for elected officials, even during the post-COVID period?
I think we have to just keep bringing up the issue and calling them to task on why does hunger exist in such in communities, period. Not in this community, in that community, but in any community, in every community. And again, lean in with the why, the lack of balance between affordability for basic needs and being able to put food on the table, that this is a trade-off. And then let's dig deeper to understand that it's not an emergency food is a start to the problem, right? It's a great way to convene and to address the basic need, but it doesn't stop there. This is a food bank saying we need more than just food to solve the problem of food insecurity. So let's lean into this broader ecosystem of need and what determines this need, and start making policies to address these root causes. And I think that's the second piece. To start with what we can all relate, making sure every neighbor has food on the table. But let's lean in and ask the second question: why don't they? And let's find a solution for that as well.
We have another question. As you know, this is an audience that's filled with educators And this person actually volunteered at the New Jersey Food Bank as a high schooler. And so shout out to her. And she's circling back to the question regarding schools and how we'll be meeting, or food banks will be meeting, or communities can meet the needs of individuals in need without schools being open. Because we do understand in every community, the schools are not necessarily providing meals to families.
So the first thing is we're meeting families where they are. They're showing up to schools. We're making sure we have evolving partnerships where we provide food on top of the meals or in addition to the meals that the schools are providing. So that's number one. And the second is we have a vast network of pantries and soup kitchens and other feeding programs, non-traditional partners and that are now serving as pantries. The Boys and Girls Club, the Wise, many in our state have adopted or adapted to be able to help provide food in the local community. So school is essential in many communities, but they sometimes are not the most central in some areas. So we're providing a diversity of programming to be able to have food accessible from wherever it's closest and more convenient to a family. But I think going back to the school specifically is we have to make sure that these meals continue. We have to make sure that every avenue and waiver that's available is taken at the local level, and that we do it as a methodical and as an inclusive way as possible and build on that. We have a fragmented way of giving families what they need to thrive. And so we have to start thinking of it that way and start looking at it, not as an either or, but how do we bundle this and make it available so that it becomes accessible? And I think to our earlier point, and let's talk about it in the positive. Let's talk about the need to keep your family food secure, to nourish their well-being, as opposed to, address hunger and these other very real things that no one wants to associate with. Nonetheless, a person who's actually going through the problem. And so I think there's an important psychological piece here that we all have to help shift.
Well, let's continue with our strengths-based conversation. How is the business community responding? You've shared how grocers are. Talk a bit more about the broader corporate and business community.
So many corporations have in fact stepped in, and I think it's part of why we've been able to have such a robust response initially. The challenge is not necessarily right now. The challenge is in our ability to provide a continuous response and fuel financially the recovery efforts that's in front of us, which will take years. No mistake about it. It will take years to be able to fully recover for many families from this. And so corporations have in fact stepped up. We can use all the help that we can receive, not just now, but in the future as well, because this is a marathon, and we need to make sure that we're fueled for that type of response. So we invite any corporations that want to be a part of that response and want to be a part of keeping New Jersey nourished, strong, healthy. It starts with a balanced meal, and we can provide that.
As I think of our communities and that we serve, and know that 26% of Black families are food insecure. As we are working to put together aligned policy strategies and the like, we understand that there are myriad things that inform our food insecurity, just as with others, but where we also have schools that can be low performing and lacking in resources. Do we find that there are equitable resources available during this time as it relates to food insecurity? Are those schools given the resources and the ability to make sure that meals are available on a Monday through Friday basis for their students and families?
So I think it's hard just to answer that question because we're talking about 600 municipalities and almost as many school districts in New Jersey, and there's varying levels of capacity. But by and large, what I have found is that where there's a higher need, a higher percentage of free and reduced school meals specifically, it has been easier for schools to just keep the program going, right? Absolutely keep the program going. Where there were pockets of need, right? Maybe under 50%, and it's a little harder because of policy issues and reimbursement issues. There are challenges and there are questions whether the local school district will be left holding the bag. So this is going to be something interesting, and that continues to unfold, right? Where we know there was a large percentage of free or reduced school meals, again, they just keep doing what they're doing, and the food was there, the supply was there, the budget was there. But where you literally had to count every child in need, because you don't have a more universal process to feed a child, I think it becomes financial concerns come in, and it becomes areas where we have to kind of lean in. And it's interesting because that's where I think the vast majority, where you look at hunger and where it lives in its totality, you see it living in the shadows of wealth. And it's where I think in the systems haven't really caught up to give everyone equally a free meal, as opposed to you that are in need. And so there's a disparity there. And of course, that's where stigma comes in. And there was a lot of conversation early in the year about, shaming for those who had reduced school meals. And I think it's going to be interesting to see how this kind of plays out in the long run. But the bigger piece in terms of access to educational resources, which I'm not an expert in, but you start seeing it happen, which school districts were able to, prop up virtual learning very quickly because there were, laptops or computers available, versus other communities where that wasn't the case. And even if the tool was available, was the access available to get on the internet, and so on and so forth. So I think there's a bigger story here that's going to unfold in terms of who will lose how much ground. And again, you'll see the disproportionate impact of this among the most vulnerable.
So there's who will lose more ground, and then where there might be opportunity to retain some of the gains. As I know the mayor of Atlanta, Mayor Keisha Lance Bottoms, expanded broadband to ensure that her families would have access during this time. We look to see, will some of those things be sustained? Because they would definitely benefit the broader community. And I'm thinking about that in this space as well, hoping that the increased interest because of the need will be sustained, and more of us will take time to better understand the issue, and also the solutions, the best practices, those places and spaces where we can contribute. On the note of contribution, I will ask again, I will try, let me know if I don't get this right. We've been asked again to share your information. It is cfbnj.org. If you would like to volunteer or donate, cfbnj.org. We're still taking questions. We do ask that you submit them via the Q&A icon and not the chat feature. As we are celebrating 50 years here at the National Black Child Development Institute, we have continued to be committed to an informed policy agenda that is aligned. You talked about the fragmentation of the food space and arena. We have a similar fragmentation in the early learning space. Do you engage support, perhaps not the early learning centers, but the family, friend, and neighbor care spaces where there is, a loving individual who's providing care and education to young people as their parents are working or out of the house?
Yes, but I think there's more opportunity to do that, and there will continue to be more opportunity to do that. We don't know how childcare is going to evolve, right? Or if just any kind of care is going to evolve and reopen in this next near term. And so I think there's opportunity to make sure that as traditional, non-traditional, hybrid traditional spaces reopen up, that we can lean in and provide all the resources, including food, and especially meals, in a way that's accessible and meaningful to families. And I think it's that last mile of getting to these unique doors, right, and unique homes, the meal in a consistent basis, I think is the bigger challenge in front of us.
Yeah, as you say that, I think about the things that keep CEOs up at night. And so one of those is that often the access point is so critical. And if it is that some of these early learning centers are unable to open, what will that mean? How will our families access? Is there a way for all of us to do a better job of promoting the availability, accessibility of food, so that if those centers don't reopen and it's August, September, our families know how to access. And we understand that you're promoting, you're sharing, word of mouth is great, but how else can we ensure that the word is getting out?
I think we have to keep promoting and keep having the conversation and inviting people to re-engage with food banks and providers, because I can tell you the food bank of today is not the food bank that existed in February, and it's certainly not the food bank that existed a year or 2 years ago. And it's part of um, allowing ourselves to divorce ourselves from the misconceptions and what we thought was, and invite ourselves to learn what is and what is possible as we lean in to rediscover and reimagine what solutions look like. And so we say this consistently, even to our network partners and to folks. We have to really reimagine how we're going to collaborate and coordinate efforts. And for us, what that means is I'm going to lend a shoulder when I need to lend a shoulder, and I'm going to provide a lift where I need to do the lift. And that means I won't do things that maybe I were beloved at one point, because I need to do more of what the community needs me to do. And I think that's an honest conversation that, as providers of any kind in the human service space, we have to be willing to have, because we need to stretch our resources. And more importantly, as we talked about, we need to coordinate our resources so that we can provide wraparound services that are fragmented by design, by funding, by so many different, by capacity in the communities where it's needed the most.
We've recently been invited to participate in a conversation that deals with healthy food options, even in the space of dealing and coping with hunger. And it's wonderful to see that they are working towards alignment so that the disparate voices are represented. Do we find often that those who are most directly impacted by food insecurity are in the room and able to inform the solutions as these conversations are underway?
Not enough. Plain and simple, not enough. And I think when you speak about health, healthy choices and healthy food, that's such a personal topic. I mean, food in and of itself is so social, it's so personal, it's so cultural. It's not a space where nutrition can be and talk about healthy eating cannot be done at someone. It has to be done with someone, and you have to socialize it. And those of us who have kids know that it takes 14 to 16 exposures to something before they gravitate and embrace it. That's what the science teaches us as well. I think we need to treat each other with the respect that we all deserve, because we're not eating a certain way as any part of the society and any part because we choose to. There are underlying issues as to what we had access to, what we grew up with, and why. And there's an education process and a socialization process that has to be done very intentionally and deliberately, and with humility and respect to our neighbors, to invite them and introduce them to new foods that are in fact healthier. That's a complex issue, but I think it involves having our neighbors at the table and having their voice and their perspective and meeting them where they are as we present solutions and opportunities.
I love that you framed it that way. I've been a part of those conversations where, I'm saying they can't afford that option at this time, therefore. And the volunteer is well-intentioned, but just not really understanding how he or she is projecting, and at times even bias into the space, and not fully hearing and understanding who the families are, what the challenges are. There may be food insecurity, housing insecurity happening simultaneously, and that everyone who's entering the space enters with compassion and a desire to understand. It's so important that when you are there to help, to support, that you're doing that from the right posture. And so I really appreciate what you were just sharing. Do you offer training to the volunteers as they're coming in, so that the appropriate kinds of conversations and support are always what your families and individuals are experiencing?
Yes. So first we train ourselves. And then and we train ourselves and the neighbors that we're and the diversity of the communities that we're serving. And then we train our partners, even the faith-based communities. I mean, sometimes we're the strongest and biggest holder of stigmas. And I say we in a collective sense. And I think so we have to arm ourselves and we work through from ourselves, through our partners, to do this thing that's unnatural, but should be natural, which is just walk in with a big set of ears and listen and embrace and speak with, not at. And our nutrition education, of which we have a large program. We have over 40 nutrition educators that are designed to lean in and explore the problem, where it is and how it exists, and in a way that's contextual to a child, a senior, a family, keeping in mind the access issues, keeping in mind the science of what it actually takes to socialize good eating habits and have it be sustained. I mean, listen, there's a disproportionate impact in healthy food eating and nutritious food access, but it's a societal problem in large. And it's that way for many different reasons that we don't get into, and many policy reasons that we won't get into. But we have to lean in with that understanding first and foremost, and again, meet the population and start unraveling that in a way that makes sense.
This is a somewhat delicate question coming from a conversation I had last week with the CEO of a local nonprofit in the District of Columbia. There is a partnership with an established food bank, or at least food outlet, and an elected official. And they are working hard and delivering bags of grocery every week to some of our more challenged, our communities that are experiencing challenges. But what we're hearing from the families is that the produce is rotten or old. Talk to us about how we address that from a position of gratitude, that the desire to assist is there, but also this isn't food that we can consume. How do we have that conversation and ensure that those who are trying to support don't walk away bitter and dejected?
Yeah, so there's a lot to unpack on that one, right? Because
please.
Right, we have to provide food that's adequate for consumption. But we also live in a society that teaches us that pretty is great and everything else should be discarded. And that's very true for produce, right? So a little blemish on something that I know I grew up eating or cutting away or being taught to do that doesn't mean the whole product is bad. It just means it may not look the way you're taught it should look. So that's a big issue on the issue of food waste, right? That ugly produce is not a non-consumable or even tasteless produce, or something that tastes bad. So that's first and foremost. And of course, there may be in terms of donations and valuable donations, there may be that 10%, 20% that we have to pick through to get at the 80% that's good. Let's not allow the 20% to discourage the 80% that's really good in terms of product. You get 10 peaches and 2 of them are not good. Well, go for the 8 that are. And I think that's something that we have to work through. We are a secondary food distribution stream. We have to be effective and efficient, but it's not going to look like what you pay top dollar for. But it doesn't mean it's not good, it's not healthy, and it's not as nutritious. And we have to kind of also work through the biases in terms of food waste and what we're taught is available or not available. The whole concept of expiration dates is one that we can spend hours talking about.
Indeed.
Because food just doesn't go bad that way, the way we assume.
As a college student, I learned that. Carlos, this has been an incredible conversation. I feel that we could go on for hours. We do have another session starting at noon. Thank you for coming, sharing, helping us unpack food insecurity, food security, better understand what it is to be food secure. And I look forward to future conversations and definitely visiting your food bank when I'm in your area. As I shared with everyone yesterday, the National Black Child Development Institute is partnering with Community of Hope African Methodist Episcopal Church and Trinity United Church of Christ to ensure that our families are receiving meals. And so we've launched a matching campaign to increase the number of meals that can be and will be distributed to families in the DC metropolitan area, as well as Chicago, Illinois. We invite all of you to join us in supporting this campaign. If you're giving now, between now and May 31st, you will be matched dollar for dollar up to $7,500. To donate, please visit NBCDI.org, NBCDI.org, to support the COVID-19 matching program. A couple of announcements as we are ending this session. Our next session starts at 12 noon. It will focus on the Black economy and will feature David Clooney, and the moderator will be NBCDI's Senior Vice President of Institutional Advancement, Jocelyn Sturdivant. At 1 p.m., we will have a panel focusing on social work that will be moderated by NBCDI's Senior Vice President of Policy, C. Murray James. And at 2, we will have our Lunch and Learn session that will start promptly at 2 p.m. It will feature BCDI Mid-Hudson's president, Linda Melton-Mann. And lastly, and I hope you're ready, I'm excited, I cannot wait, our homeschooling session, our homeschooling happy hour will be this afternoon featuring Jonathan Hines, who is the Georgia Pre-K Teacher of the Year. Thank you for joining us, and please stay for the rest of the day. Happy National Black Child Development Week.